this is gonna be our typical patient. I mean, if you're in your 20s, we're probably just gonna recommend some basic skincare, some preventative Botox in small doses and really spaced apart maybe every 4 or 5 months. If you're coming at a later age and you already have signs of sun damage or you have some sort of other skin concerns, we're gonna see you more frequently. Our typical patient who's a member will come in every month for a HydraFacial. That's like a really deep cleaning of the pores of your skin. They're probably gonna come every few months for tox treatments, and they're gonna probably come every 6 months to a year for filler treatments. And that, I would say, is our typical patient. Our typical patient's also gonna be very cognizant of preventing sun damage by using certain types of sun protection, hat and mineral SPF. And they're going to be using high quality medical grade skincare, a vitamin C every day, tretinoin, which is a topical vitamin A.